Another person came in. All right, everybody, I'm going to get started. Thank you so much for joining. Just to start off with some housekeeping, that we ask that you keep yourself muted. Make sure that your device is set to an appropriate audio level so you can hear, and then we can hear you when unmuted. The chat feature is a great way to ask questions. I'm the kind of person that thinks of a question, and then when it's time to actually have a Q&A, I forget. So putting it in chat helps a lot. We are recording this webinar, and it will be available in probably less than a week on the same page where you registered. And if you have any technical difficulties, we just recommend logging out, logging back in. I keep an eye on the waiting room, so and that usually resolves any problems. So I'm Christy Bird McKeeve. I am the Executive Director of Butte Glen Medical Society and the CEO of Healthy Rural California. And both of these different organizations are part of this story, so I will do my best to explain all of that. We're going to be focusing on community, the lessons from the campfire. And in addition to myself, we'll have Kiki Nocella, who is the director with WIPFLE, and Maggie Fassbender, who is also with WIPFLE, and have been on this journey with us. We also have Scott Kennelly here, who's very much a part of the effort, and happy to have him correct me, add anything as they come up. And we did have some polling questions, so hopefully you filled those out. That helps us understand how we can provide more webinars in the future or assist with anything that you're doing. Quickly, just a review, we have 8 webinars in this series, and they were started in September. You can see the titles. They're all recorded and available for your viewing pleasure on the same page where we registered. We also had some wonderful primers, so PDF versions that summarize these recordings that you're more than welcome to download and take with you. We are on the 7th of the 8 webinars, and next one is March 25th about board certified physicians, key to continuity sites. All of these were sort of lessons that I had wished I'd known in the summer of 2019 when we got started. So thank you to Physicians for a Healthy California, great partners in this effort, and they do a lot of the work to make this all happen. So thank you all. Paradise Medical Group was a sponsor. California Medical Association also contributes to this effort. And of course, the Butte Glen Medical Society Residency Task Force, made up of many wonderful people in the community who got together and led us to the point where we are today. So where did we start? Just to review the time frame, November 2018 was the campfire. And for those of us who live in the region, we were all part of that. Even though I live in Sacramento and Chico, Paradise is about an hour and a half north of me, I felt that campfire because the smoke was thick overhead and was just a devastating and painful time. Even though I didn't live in the area and didn't work in this position until January 2019. Prior to the campfire, I want to make very clear that we had access to care issues. They were chronic, they were worsening. All of the counties in the region have this same issue, but for us, the campfire was that galvanizing moment. We have no large health systems. No medical schools, and so it's kind of an island within the healthcare world of Northern California. Just a lay of the land, Butte County had 4 hospitals, and approximately 26,000 people lived in Paradise, in Magalia, Concow, so it wasn't just the town of Paradise, it was the neighboring communities as well that were impacted. The fire destroyed the healthcare infrastructure in Paradise, including Feather River Hospital. So we went from 4 to 3 hospitals in that month. In addition to 26,000 people needing to vacate the region, a good half, I'd say 10,000 plus, came into Chico, which is neighboring Paradise. Paradise is basically up on a ridge, and Chico's below that. And so then it impacted what was happening in Chico with their healthcare infrastructure as well. I started in January of 2019 and was new to the area. So I'm going to describe what I saw in the coming months, but I just wanted to further point out that FEMA ended their work in the area on February 1st. And we began discussions with Physicians for a Healthy California to grant money so that we could address access to care issues in the area. I'm going to say that between January and June, for me coming into the area as a new person, it seemed like it seemed really quiet, and people just seemed sort of dazed and disoriented a little bit. And it wasn't until later in that year, probably the fall, winter of 2019, that I began to see what the community was really all about. That's how impactful the campfire was, just on the psyche, on the community struggling to repair itself, to accommodate new people into the area, and the loss of Paradise right next door. So our first effort was to do a directory of physicians. That's something that Butte Glen Medical Society would have been doing for decades. It was kind of our way of contributing to the community. And we hadn't done one since 2015. And we also were estimating that with 40 to 60 physicians leaving because of the campfire, that we needed to find out where everybody landed, if they left. And so we embarked on that, and also found out that about 300 to 400 practice staff associated with Feather River or living in Paradise also left. I mean, this is an enormous impact on healthcare and just access to care, right? It really just made everything worse. In addition, in September, I meant to say 2019. Yeah, September 2019, sorry about that. Butte County produced their health needs assessment, and their, by far and away, the number one need was access to care. And so we as Butte Glen Medical Society said, we need to think about this. Second to that, with the county health needs assessment, was mental health. And so coming into these discussions about a residency task force, it's really important for you as a community to truly have that data to back you up when you say things like, oh, I want to have a residency program that's focused on, I don't know, emergency medicine or something. You'd have to have the data behind why that's needed. And so the county health needs assessments are a really great tool to go by. What we saw in the wake of the campfire was a greater spirit of collaboration. So when you look at something that was so devastating and impactful on a community in a negative way, it's important to recognize the good that came out of it. And from what I understand from before the fire, there wasn't necessarily that collaboration. And what I'm talking about are all the different hospitals, clinical facilities, everybody working together. And I think it was March of 2019, I attended a county-led healthcare sort of consortium that had been created before the campfire, but thank goodness it was in place because people knew each other, and they may not have been collaborating proactively, but because they had known each other, they were able to respond really, really well and come together to save the citizens of the community, but also just sort of, keeping everybody working together for all the patients that needed attention. I'm sure there's people who could describe that much better than I, since I was new to the community, but it definitely was one of the reasons I wanted to point out for where we are today. It also galvanized the medical community to take action. It really was that, we have to address access to care. And the most obvious way, the evidence-based decisions that we could do was to create a residency task, the residency task force, and find out how we can create residency programs in the area. The third point that I wanted to say was that we really did garner a lot of attention, a lot of funding. And I think it kind of helped us with a can do, like, you know, yes, we can do bigger things. We can tackle these terrible issues in the community and be successful at it. So I just wanted to point out that when you're thinking about coming together with a community in the wake of something so destructive, sometimes there's these good things that come out of it that can help you, you know, galvanize your community to solve those problems. So we actually met with an assembly member in July of 2019. It was part of our usual efforts from Butte Glen Medical Society, and started talking about the access to care issues. And he recommended that we create the residency task force. So our first meeting was in August, and we had an open door, welcomed everyone, just continually invited people to come to the task force and talk about what was needed. And almost immediately, we heard about a psychiatry residency that had been in the works and trying to get feet to stand on. But because we already had the county needs assessment saying access to care and mental health were the two top priorities, the psychiatry residency was like a clear fit, and everyone, and nobody hesitated in coming together to start tackling how can we bring a psychiatry residency to the area. And then because of all of the trauma from the Camp Fire, the trauma-informed care became a big focus. And it has been it's a great focus of the community, and thanks to North Valley Community Foundation, who has started off with a healing initiative, which is now called Thrive, and really just trying to embed trauma-informed care at all levels so that we are responding to our community in a better way. So on November 2019, we had a site visit for the psychiatry residency. We had a very positive response, just a bit of a concern about recruiting psych residency to the area. To note, there are no psychiatry residency programs north of Sacramento. So there's, you know, it's kind of there's no medical school in our counties. The closest would be the three, UC Davis, North State, and Stanford. And so we had to start figuring out how to make this really come to fruition. But there didn't seem to be any traction, which is the word I continue to use when you're sort of getting good people together and making good decisions and having a great vision, but you're not actually getting something established. There's agreements, there's funding, there's a whole bunch of stuff that has to happen in order to make a residency program happen. So with a grant from North Valley Community Foundation, we were able to hire Kiki Nocella, who is a director at Whipfly, to conduct a feasibility study. Speaking of no traction, what I have learned is that having a feasibility study is really key to moving forward with a residency program. It can reveal data that you weren't aware of, maybe some really great potential clinical facilities, or maybe some not so good situations. So having a feasibility study is one of those tools that's really important. And we had a separate webinar in this 8-part series that focused on that in greater detail and why that is a good tool to have. Just to know it takes money, and you know, it takes somebody like Kiki who knows the ins and outs of what it takes to establish a residency program. So you know, those are just the facts. It was kind of a surprise to all of us in the community as we said, okay, we need a feasibility study, let's make that happen. And the price tag was high for what we were thinking, but now I know it was not that high in terms of the value that you get from such a tool. So Kiki shared the feasibility study report in July of 2020. And by August 3rd, I think it was July 14th, by August 3rd, we were taking that feasibility study to apply for a statewide OSHPD PEC WET award of 1.8 million. And that was the projected need to get us through accreditation to psychiatry residents coming to the area in the fall of 2023. we were awarded that. And so it was all very exciting. And the feasibility study and award are based on Healthy Rural California, which is our separate 501c3, leading a GME consortium that is locally run. And to note, the reason that having a consortium, and it enables a rural community to have all of the different pieces that are needed in order to make sure that each resident has the broad experience that is required of each of those residency programs. And very seldom in a rural community do you find one clinical facility that can give all of those needs and meet all of those needs of the residents in their academic journey through the residency program. So having a consortium is a really great idea, but it's also a longer process, which requires a lot of money. So you just have to weigh those things out, and the feasibility study really helps understand what is possible. The pandemic has really been a bit of a stumbling block. We were able to conduct the feasibility study virtually. We've been able to have meetings virtually, but I would say that my advice would be maybe not trying to launch a consortium in the middle of a pandemic, but we did not want to wait, especially since we were awarded the OSHPD grant. We just thought we have to get going on this and make it happen. So we were meeting again, we were able to meet in person in November and December, but then the surge happened and one of our main partners has had to step back. So again, when you're working in a community like ours, they're not, they're having to respond to what's happening around them, and sometimes not able to commit the time and energy to the effort that the consortium is trying to build. We did agree to raise about $1 million in order to reach accreditation in the fall of 2022. And we're still in that process. I'm happy to say that as of this morning, we were able to confirm that we have a DIO, which is a very important step as we move toward being a sponsoring institution. In addition to the pandemic, we also had the North Complex fire, which was it was about the same time frame, I would think, of the Camp Fire in terms of smoke overhead and sort of evacuations and level of trauma. So it has definitely been a challenge to move forward with this. Challenging in normal circumstances and ordinary circumstances, but we've had some extra things thrown at us, but it makes me proud of the effort that we have continued to push forward. Just an update for the moment, the GME Consortium and Healthy Rural California has hired Kiki again to help us through the process of sponsoring institution accreditation and then into the psychiatry residency accreditation. We're starting a business plan, we're building the GME Council, and I'm sure Kiki can give a lot more information than I, and Scott is also welcome to contribute. It's been an amazing journey, full of some roller coaster rides, but we had a meeting this morning and it just made me feel positive and energized again. So onward we go. And so Kiki, are you ready to take it from here? This is her slide.
Sure. So as part of this, Christy asked me to do two things. One, to talk about talk a little bit more about the journey so far, and two, share a story out of another, from another group who set up a psychiatry program born out of a disaster. So let me do this slide first. Somewhere along the journey, I want to say it was June, probably June, we were looking at a planning grant that was available from HRSA for rural. And one of the things that comes up quite frequently is both with Medicare GME funding and with various grants that might be used for GME planning is where are you located, and is it in rural? And so I pulled some things as an example. They it actually are different pieces cut and paste on top. It kind of looks a little more seamless than it is. There is a wonderful website called ruralhealthinfo.org/MIRural. I just always Google "Am I rural?" because that's the only thing I can remember. And when you Google "Am I rural?", you can put in the address of the location you're thinking of, and it will generate a report. And I just cut and paste some pieces from generating a report with Glenn County. Okay. I didn't paste all of the definitions, but it will go through and say, yes, this one qualifies as rural. Yes, that one for the Federal Office of Rural Health Planning. Yes, that is rural. For Medicare, yes, this is rural. And here's the key. For Medicare, as it pertains to graduate medical education, and for the HRSA planning grant that we thought we'd apply for, but in the end didn't, what mattered is this definition right here, your core-based statistical areas. And Glenn County, this location in Glenn County, and pretty much all of Glenn County, counts as non-metropolitan, meaning not located in a metropolitan or micropolitan area. But when you get into Chico, when you get into Butte County, pretty much all you have, except for Gridley, is considered metropolitan. And so pretty much everything was off the table as far as our ability to go after that rural grant. Excuse me, I've got, I think, allergies going on and just a upper respiratory thing. So only if we had partnered with Orchard Hospital in Gridley could they have applied for the grant, because they were the only one who was not metropolitan in Butte County. And so these definitions really matter, and it just adds another level of complexity. And in the end, because of a lack of time, really, to do the sort of groundwork we needed to do, we didn't go after this grant, but there are always opportunities in the future. So just watch that website. It's a good one to have if ever you're wondering or thinking about what are my, do I fit or not? Okay, so a little bit about a story. And the story is about Joplin, Missouri. I had the honor of being part of a evaluation team with George Washington University for HRSA. And with that, we got to do site visits of a number of teaching health centers. And the part I was looking at was, what does it cost to train a teaching health center resident? But in doing the site visits and key informant interviews, that's one of the ways that we gathered data. So we go to Joplin, Missouri, and it was roughly in 2014. And I'm sure folks remember that in 2011, they had a EF5 tornado blow through town. And it destroyed one of the hospitals, it destroyed a high school, it destroyed an awful lot, and a lot of people died from it as well. Now, there was a community mental health organization called Ozark Center, and the Ozark Center had been around for something like 50 years. It had been around for a while, and it had been doing some of the things that Christy has been doing, applying for grants and adding services based on applying for grants. And they got a series of HUD funding so they could add residential care. And, they just kept building and growing and building and growing. And although they always wanted a residency program in psychiatry, that was too great of a lift until the tornado. When that happened, the community came together in a way that it never had before, and mental health was the priority. And so the Ozark Center went forward to, at the time, AOA with their accrediting body, and got accredited as a psychiatry residency program. And what was really cool, there's so many really cool things about this. One of the things that was really cool about this is the fact that over these years, with all these different grants and programmatic funding that they'd gotten, they had built all of the bricks and mortar and all of the services that you would need for a robust residency program. They didn't have to look to outsource it anywhere. They had it all. Second, the startup funds were raised by the community to get this going, because even going 3 years later, I trust me when I say I'm not exaggerating. You felt it in the air the moment you stepped off the airplane. You felt what folks would refer to as just a community-wide PTSD, and you could still see it. You know, anywhere that there was a new building, that was the path of the tornado. Can you tell I'm a native Californian? I thankfully, knock on wood, have never experienced either. So they had funding to do the startup, and then they applied to be a teaching health center, and they got that funding as well. So through this, they created a very viable, very meaningful psychiatry residency program to help address the needs of this community that at that point had so many needs because of the trauma that they had been through. It was there that I first learned about trauma-informed care, which is being woven into the foundation of everything that is being planned in Butte Glen County. So the psychiatry program of a curriculum throughout all 4 years that is based in trauma-informed care. You're not going to find that in psychiatry programs right now, which is kind of baffling, but it is what it is. So it will be cutting edge. We're also talking about a family medicine residency program. And in doing that, family medicine has a very strong behavioral health component. Well, let's look at trauma-informed care there as well. Because if ever there's a community that has gone through multiple traumas, it's this region. So that's the story I love to tell. It's a huge success story out of a horrible disaster. And if they can do it, anyone can. So I'll pause there, Christy. I know it wasn't a whole long presentation, but that's the story of Joplin, Missouri, and Ozark Center.
Thank you for sharing. It's okay if we are not going to take a full hour. So if anybody has any questions for any of us, please unmute yourselves and ask away. I'm excited to see so many people on the call today. I do want to say thank you. Lupe Alonso Diaz is here. She is the CEO of Physicians for a Healthy California and has been a fantastic partner for us in all of this, starting with the access to care needs following the campfire.
Is there anything else you want to touch, or you want me to touch on, since we have a few minutes, or?
No, I'm really glad you mentioned what you did. Right, the excuse me, the Teaching Health Center grant that we did not apply for. It was definitely an interesting thing. I'm glad you mentioned that, I should say. Thank you, Lupe. I don't know, does anybody have any questions, like anything that you would love to know from us? It doesn't have to necessarily be from this particular topic.
Oh, this is it's on topic. I'm Stephanie Booth, and I was just wondering, I understand, and it might be a rumor, but I don't think so, that Medicare funded programs west of the Mississippi don't get as much money as they do on the other side of our country. Is that true?
There are certain states, not to pick on New York, but New York, that have phenomenally high reimbursements, yes. The formula for Medicare reimbursement is one that is based on, first and foremost, Medicare's fair share. Medicare only pays their fair share. So to the extent a hospital is receiving a high volume of Medicare patients, they'll get better GME reimbursement. It is also a function of the ratio of interns and residents to beds. So you literally can walk out of one hospital that's getting paid X per resident, walk down the street and go into another hospital and it will be paid Y for the same resident doing the same training. It's a pretty bizarre situation, but it has been this way. Well, the direct component of it was started in the 60s with the advent of Medicare, and the indirect component of GME reimbursement was started in roughly 1982, I think, right before DRG. So it's been this way for a long time.
Thank you for that.
Sure.
Can you say a little bit more about how people raised money for any of the projects before they went through the disaster or after?
Oh, well, my memory is not that good, but I will share with you generalities. Foundations are always a great place to start. Local foundations primarily. I mean, the big ones and those states that have statewide foundations like us in California, everybody goes after them, right? So it's the local ones where you can get 100,000 here or 100,000 there, or less or more. Another place that people go to raise money is the managed care health plans. And again, I'm focusing here on California, but I know folks who've done a very, very excellent jobs getting support from their Medi-Cal managed care provider or providers. And up in the North State, oh, I just blanked on their name. Christy, we were just talking about them this morning. Help me. It's a P.
Partnership.
Thank you. Partnership. Thank you, Scott. Partnership has an excellent track record of supporting startup costs for residency programs. So that's the other low-hanging fruit that people go to. We've tried, and I should mention also in the state of California, since we're all Californians, we have a very generous Song Brown grant program, and of course the Cal MedForce program that Lupe heads up. Song Brown has a pool of funds for startup. The catch, which is often the catch with startup funding, is, well, we don't want to give you the money if we don't know you're going to make it. So with Song Brown, the money is contingent on you getting approval, accredited as a program. And that runs, you can get as much as $800,000. That's also general fund dollars. So, it is going to vary based on who's in the governor's seat. It's going to vary based on things like COVID. So we've managed to hold on for this past year with Song Brown funding, but I bite my nails every year, as I know Lupe and others in state service do as well.
You can't really help it.
Yeah. Yeah.
I think that's great. I congratulate you all for doing this work. I'm quite sure I would never have known where to start. So thank you.
Sure.
I did want to add that the state is starting to also understand that, it's a heavy lift. And if they could support it, there's some language in the budget as it's going through the sausage making process right now that could bring some more funding to help residency programs expand or start up. No promises there, but I did want to note that it was March 9th, I think, last year. Myself and 3 physicians with Butte Glen Medical Society, we were in the state capitol at an assembly subcommittee hearing, advocating for $25 million for the North State, so north of Sacramento up to the Oregon border, to establish new medical residency programs. I mean, the next week COVID happened, and all of that extra funding that was available in the state, if you remember, was just, you know, was supposed to be dedicated to healthcare and homelessness, I think. All of that money just disappeared because of COVID-19. But, you know, there are advocacy efforts. There's a lot of different ways to approach the needs of the region, community. Yeah, Kiki really did list the most obvious ones, but I don't know, think big and keep trying.
So it really is kind of off topic, and you can tell me so. But I was wondering, we're talking about the money, and I don't really see how Governor Newsom's plan to carve out the pharmacy piece of Medi-Cal is going to really save any money. Are you, either of you, aware of that, or have any opinions or thoughts about it? Or too far in left field?
I am aware of it. I do a lot of work with federally qualified health centers, so I'm definitely aware of it. And I think it's probably best not to for me to opine on it, because it probably doesn't matter anyway. And I can't say that I feel enough of an expert. We at Whipley, the firm I'm with, we have 340B experts who could give you the pros, cons, up and down, sideways and backwards. Me, I'm aware of it, and it's probably safe that I don't opine on it. Or as others would say to me, I need to stay in my lane.
That's completely fair. Thank you.
Sure. Where are you from?
LA County.
Oh, that's where I'm at. Are you with the county?
I actually, the only connection I have to the county is I'm on the LA Care Board of Directors.
Oh, well, hello. LA Care gives support to residency programs. Sorry, I didn't mention them.
No, that's okay. I already knew them. I knew you were thinking about it.
It's just we're talking North State right now, so.
Well, I guess I'm all questioned out. I really appreciate that.
Okay.
Not a problem.
I have a couple more tips I'll just share quickly. I've shared them with the previous webinars, but I do have something similar recorded on our YouTube channel. It's the Butte Glen Medical Society YouTube channel that kind of goes into more detail of the ups and downs up until this fall of establishing our residency program. Just keep focused on creating an effective and positive experience for residents from the very beginning. That's a huge way for me to keep marching forward in this effort that we have, because ultimately that is the test of whether you're successful or not. And if it's not positive from the very beginning, from the day the residents come on board, it could go down pretty quickly. So that was advice that Kiki had given me earlier on, and I want to share that with everybody. I think I've mentioned this a couple of times. The journey is resource intensive. It will take much longer than you could ever imagine. I'm still realizing that. But it helps to keep an explorer mentality about like what will work, what can we make happen, what's possible, and continually moving forward to those more positive places. Casting a wide net is really important when you ask about fundraising, Stephanie. That's another tip that I have, which is, you know, create a residency task force, involve everybody, your legislators, foundations, get them involved from the very beginning so that they can understand when you have an ask why you're asking for those funds and how they can actually contribute to the access to care needs of your area. Consider your local medical society. It's not normal for a medical society to be this active, but I think I explained in what I was describing earlier why Butte Glen Medical Society has been such a driving force in this consortium. And my board just early on said, let's make this happen, and that's what I did with them. So don't rule them out just because it's not the norm. You might find a great asset in your local medical society. Prioritize and focus on your greatest needs in the community. I mentioned that before with the county health needs assessment. And then hire a consultant. I mean, I don't think we would have progressed at all if we hadn't hired Kiki and Maggie to really move us forward and understanding what we needed to do next. I also wanted to mention that the California Healthcare Foundation recently, this was probably now the fall, October, November, announced that they have some GME resources, some great literature, possibly, hopefully some funding in the future, who knows, but they're dedicating a portion of their foundation to supporting GME residency programs in the state. So always good to check them out. All right, well, if we don't have any more questions, we can all get back to the work at hand. I'm excited. We have a DIO for our GME consortium, and that was a meeting this morning where we confirmed that and just need to go through the processes of formalizing that. So it's exciting.